You start taking creatine supplements for your gym workouts, or maybe you do your routine blood work and boom, your creatinine number is flagged red. You Google this and the internet immediately tells you that your kidneys are failing. But take a deep breath. High creatinine is not a diagnosis, it is a signal. And in many cases, you can bring it down naturally. Hi, all. Dr. Neha Garg here, a nephrologist and an Ayurvedic health counselor. Today, I will share tips to help lower your creatinine or even improve early stage kidney disease. Stay till the end for a free downloadable kidney health action checklist. So let's decode your labs. Creatinine is a breakdown product of muscle metabolism. Think of creatinine like dirty water in a sink. Your muscles are the faucet and your kidneys are the drain filtering it out. When the drain slows down or you turn the faucet on full blast with very heavy protein meals, intense workouts, or creatine supplements, then this water level rises. This may not be actual kidney disease, but if it stays high for months, then it is certainly concerning and needs more workup. Ayurvedic remedies that are backed by clinical evidence. Number one is Punarnava. The name literally translates into the one that renews. In a clinical study of 100 patients with chronic kidney disease, a Punarnava based formulation reduced serum creatinine by over 20%. It has a diuretic and an anti inflammatory effect. And in animal models, it has been found to reduce fibrosis or scarring of the kidney cells. In Ayurveda, this is typically taken as half a teaspoon of powder in warm water at bedtime. Do not take this if you are pregnant or if you are on blood pressure medications, especially diuretics, as this can cause dehydration and low blood pressures. So always consult with your doctor first if you are on prescription medicines. Remedy number 2 is Gokshura. Gokshura acts as a mild diuretic and reduces calcium crystallization in the kidneys. It is kidney stone preventative. In a published clinical trial, a combination of Gokshura and Punarnava showed 75% improvement in kidney markers in diabetic patients, outperforming enalapril, which is the standard of care blood pressure medicine. The combination was found to be antihypertensive along with diuretic effects and help reduce kidney scarring as is seen with enalapril. However, these two herbs have active medicinal properties and they are not to be used without consultation, especially if you are on blood pressure medicines, blood thinners, or any other medications where there could be a role for an interaction. Moving on to Ayurvedic remedy number 3. This is coriander seed tea or coriander infused water. Most people have never heard of this, but coriander seeds are the safest and readily available solution for early hypertension and urinary disorders. Coriander seed tea acts as a mild diuretic and it naturally increases the urine output, reducing edema and lymphatic congestion. It helps flush out the excess kidney toxins as well as heavy metals from the body, and it reduces bladder irritation. You can make coriander tea or a cold infusion by boiling 1 to 2 tablespoons of coriander seeds in 6 cups of water. You can drink it hot as a tea or you can cool it and then use it as coriander infused water. Remedy number 4 is barley water. Barley water is simple, inexpensive, and quite powerful. Barley contains beta-glucans which reduce kidney inflammation and they have an anti-diabetic effect with a reduction in insulin resistance. Boil 2 tablespoons of barley in 4 to 6 cups of water for 15 minutes and keep this tea overnight. Next morning, strain and sip throughout the day. Moving on to the 5 medical tips to help reverse mild creatinine elevation or early stage kidney disease. So tip number 1 is hydration. this is foundational. Your kidneys need water to physically flush the creatinine and other acid toxins out of the sink. Aim for 6 to 8 glasses of water and more if you are taking creatine or protein supplements. Tip number 2 is swap the red meat. A red meat heavy diet produces an excess of urea and acids in the system, increasing the work burden for the kidneys. A large study by National Kidney Foundation showed that replacing just one red meat-based meal in a day with plant-based meal reduced the future risk of end-stage kidney disease by 50%. Plant-based proteins tend to be more alkaline and are kidney-friendly. From my clinic experience as well, I can guarantee that this simple diet fix can actually reverse early-stage chronic kidney disease and get your creatinine back to normal or near normal. Tip number 3 is you reduce your salt intake. If you have been diagnosed with early-stage kidney disease or hypertension, then reducing the salt in your diet is essential to slow down disease progression. Most people think that this just includes the white table salt, which is sodium chloride. But even more harmful than the table salt are the phosphate-based salts that are used as preservatives, and they are found in all packaged foods, including sauces, pickles, dressings, and ready-to-eat meals. Point number 4 is review your medications. Common painkillers like ibuprofen, high-dose aspirin, and certain antacids can raise your creatinine levels, and if taken for a long period of time, they can cause permanent damage to your kidneys. So if your numbers spiked recently, ask your doctor, could my medications be causing this? One question could change everything. Tip number 5 is get a urine protein test. Most labs only check your blood work, but a urine protein test tells you if your kidneys are actually leaking protein, which is a more accurate marker for real kidney damage. Ask your doctor to add it to your next lab panel. These natural remedies are for mild creatinine elevations or early stage kidney disease. You need to see a nephrologist immediately if your GFR is below 60, if your creatinine has been consistently rising for more than 3 months, if you have protein or red blood cells in your urine, or if you have unexplained swelling in your legs or on your face. These are the signs that your kidneys need clinical evaluation and not just home remedies. High creatinine is scary when you don't understand it, but now you do. To make this easy, I've put everything from this video onto a printable page. Click the link in the description or to the pinned comment to download your free kidney health action checklist. If this video brought you peace of mind, then please hit the like and the subscribe button. And please share this with a friend or family member who may be panicking over their lab results. This is Dr. Neha Garg here. Stay balanced, and I'll see you in the next video.